Observe the neck postures. There are so many day-to-day, man-made artificial tasks that involve flexion, looking down, head-forward posture. Over time, what happens is the neck, the cervical spine, can become deformed into what doctors of chiropractic call loss of cervical lordotic curve, or even a reverse cervical curve. This is a side view of a structurally normal cervical spine, and what happens when the curve becomes distorted through misuse. Notice the sharp points developing in the front part of the vertebrae, bone spurs. The spaces in between shrink. We actually become shorter in height. And the nerves that exit the spine become compressed. It turns out having a normal cervical curve is very important to human health too. Life force energy is transmitted from the brain in microamps through the brainstem and down through the cervical spine. When the bones in the neck become misaligned, the nerve energy gets choked off, and this is called a vertebral subluxation. Besides degeneration, bone spurs, loss of motion, and pain, one of the most important problems is overall health is detrimentally affected. I'll show you just 3 studies that can help to prove my point. Here's one from the medical journal Spine, saying that progressive kyphosis, or loss of the cervical curve, is responsible for severe nerve damage. Another out of the journal Neurosurgery shows that MS, multiple sclerosis, can be attributable to spinal cord compression, and that surgery to the spine can be of benefit with only minimal associated morbidity or deaths. From the journal JVSR, Journal of Vertebral Subluxation Research, shows that after 4 months of upper cervical chiropractic care, all MS symptoms were gone, and they remained better after 1-year evaluations. So if it's clear that the loss of the cervical curve can be devastating to human health, even causing neurologic diseases like MS, what can we do about it? In addition to specific chiropractic adjustments to correct the subluxations, I have been prescribing the home use of the Pedibond cervical wedge since 1994 with excellent results. It works very well to help restore a normal position of the cervical spine, and it can provide a lot of relief as well. It is corrective. There are a lot of devices similar to it, including mechanically powered ones, but I like the foam Pedibond wedge the best because it's safe, it's simple, and it's easy to use and operate, and it feels good. People innately find themselves wanting to simulate the cervical wedge by rolling up a towel or bunching up their pillow, but it's not quite the same. Everyone can use it, as most of us have succumbed to the repetitive trauma of too much chronic repetitive flexion tasks. Be sure to ease into using the Pedibond wedge. It's more stiff, rigid when it's new. It'll soften with use. Go easy. Maybe only a few minutes the first few times as you get used to it. It's positioned like this, flat side against your shoulders, angle end where your head goes. Position the Pedibond wedge lower in the neck than you might expect, closer to the shoulders. Roll your neck to the right and left gently. Tuck your chin, flexing the cervical spine, and push it back into the wedge. It's okay if sometimes you hear little clicks. The neck is cradled safely in this position, but the golden rule is that you should stop if it becomes uncomfortable. Extend the neck back into the wedge's angle. Be sure to do at least 3 times more extension than flexion. undoing our chronic looking down habits. Tip the head side to side. And also remember to just rest in this position. It's a good time to exercise your mind. Think of your breathing only. Take control of your thoughts. Stop the ego's chatter. Breathe. Relax. Let the Pettibone wedge do its work. I recommend the use of the cervical wedge at the end of the evening before bedtime, and again in the morning, about 10 minutes each setting. Remember not to sleep on it.